Good morning, everybody, and welcome to the launch of the Personalised Care Institute. It's a real pleasure to have you join us today. Thank you so much for coming along for what I guarantee will be a really interesting and really exciting hour. My name is Martin Marshall. I'm Chair of the Royal College of General Practitioners and a GP in Newham in East London. The Royal College of General Practitioners is delighted to host and to facilitate the Institute, and it's really exciting to have such a powerful and talented group of organisations and individuals involved in this venture. All clinicians and all carers, of course, try to deliver personalised care all of the time, but it isn't easy, particularly in the current environment, and I have to say, particularly more recently with the pressures of COVID. Part of the issue, of course, is the environment that we work in, but one of the key issues is the shortage of training, specific training around personalised care. And it's very clear from surveys of patients that we have some work to do in training both health and care staff appropriately to deliver the level of personalised care that our patients want and expect to see. We now know that personalised care requires a very special set of skills, and that's what the PCI is about. It's a virtual training hub for health and care staff, which will be offering a range of training opportunities, flexible opportunities from a range of different providers. And part of our role as an institute is to quality assure and accredit these courses. Today you're going to be hearing about our new curriculum. We'll be launching the new accreditation scheme. We'll be demonstrating the e-learning hub, and we'll be launching the first of the accredited courses, which is around core skills. So I think it's going to be a really exciting hour. I hope you're going to enjoy it, and I'd like to pass over to my colleague, Alf Collins from NHS England. Alf.
Martin, thank you. It really is a delight to be here on this absolutely wonderful autumn morning in the middle of London. Welcome to all of you from all parts of England today. As Martin said, my name's Alf Collins. I'm Clinical Director for Personalised Care for NHS England and NHS Improvement. Universal personalised care is one of the 5 key shifts that we talked about in the long-term plan. And the aim of this institute is to provide training for at least 75,000 health and care professionals over the next 4 years. As Martin's mentioned, although most of us, I guess all of us, try very hard to provide personalised care all of the time, national surveys tell us that we really could do better. And the evidence does tell us that training is the key. So that's why we're here today. We're going to have a fantastic morning learning about all the training opportunities available and the core curriculum underneath all of this. The PCI is, I think, worldwide a unique collaboration. I don't know of anywhere in the world that's doing this. There are over 40 organisations nationally that have come together to provide these training and professional development opportunities. It is unique. It is, I think, immensely engaging work that we've done so far, and we're going to tell you a little bit more about this morning. What it's really all about is bringing together what's really been trained separately: shared decision-making, personalised care and support planning, support for self-management through health coaching and social prescribing, ways of working that sit very, very neatly together. That's what this is all about, bringing them together into a core curriculum, core ways of working, but also developing and supporting people to develop unique skills when it comes to shared decision-making, personalised care and support planning, social prescribing and health coaching. So an exciting morning. We're really, really pleased to have you here. There is going to be lots of opportunities for discussion towards the end of the hour. Please post your comments into the Zoom box as the hour goes forward. And it's now my absolute pleasure to present Jo Churchill, the Secretary of State for Prevention, Public Health and Primary Care. A short video from her.
For many years, the NHS has talked about the need to shift towards a more personalised approach to health and care, so that we can have the same choice and control over our mental and physical health that we've come to expect in every other part of our life. We know that when care is shaped to a person's wants and needs, they are more likely to have a better experience and have better health outcomes. Personalised care approaches empower patients by centering on the person, exploring their health needs and goals, and helping them understand their options. And as local health and care organisations work together more closely than ever before, supported by the investment in primary care networks and the additional roles across primary and community care, they are recognising the power of individuals as the best organisers of their own care. Evidence shows us that personalised care works. It works for the patient when an individual has more control and responsibility over their health and care following open and honest discussions. Evidence suggests that it can lead to improved health and well-being outcomes, quality of care and independence. Individuals with more responsibility and control over their health and care are much more likely to benefit from health interventions, adopt healthy behaviours and see positive health outcomes, and this can improve experiences for everyone. Most people who live with long-term conditions can benefit from developing a better understanding of their health and care needs and having them tailored to their specific circumstances. However, we know that those in areas with greater socioeconomic challenges often deal with more difficult circumstances, and this approach can help support the tackling of health inequalities too. Importantly, it works for healthcare workers who report increased job satisfaction, as you can have different kinds of constructive conversations with patients. You can rebalance the relationship, working in partnership to understand and prioritise what matters most to them. And we know that this in turn frees up time to spend with more complex cases. People who are more confident and able to manage their health conditions have significantly fewer GP contacts and fewer emergency admissions than people with the least knowledge, skills and confidence to manage their conditions. Many of you are already putting personalised care at the heart of your work, I know. Yet still 40% of patients say they weren't as involved as they wanted to be in discussions about the management of their health, care and conditions. 60% felt that they have never been asked what was important to them during conversations with healthcare professionals. Moving beyond statistics, patient experience and your experiences in providing care to people repeatedly show what a life-changing impact personalised care has. That's why I'm pleased to be endorsing this wonderful resource with thanks to all involved in bringing it to life and championing the broader personalised care agenda. By providing the very latest in personalised care training, development, and the Personalised Care Institute will play a crucial role in bringing to life the ambition for personalised care to be the norm as was set out in the NHS long-term plan. The Institute will offer a range of flexible and accredited courses for all health and care professionals to strengthen your knowledge, skills and confidence. That means putting your patient's health needs in a way that works for that person with their well-being and wishes front and centre, meaning they're able to live the life they want to live, and that ambition is a fundamental motivation for all of us across healthcare and public service to deliver.
Good morning everyone, it's my absolute pleasure to join you all this morning. My name is Steve Walter, I'm a GP in South Warwickshire. I'm also a Medical Director for Curriculum and chair the core group of the Institute for developing the Personalised Care Institute curriculum. It's my absolute pleasure to launch the curriculum this morning, and on behalf of myself and my team, I'd like to say how excited we are in this new venture. The curriculum describes the quality standards and educational aims of the comprehensive model for personalised care. And what I'd like to do in the next few minutes is talk about who the curriculum is for and actually what the purpose of the curriculum is and what it looks like to the users. As Alf's mentioned, there's been a very diverse range and rich heritage of facilities for developing personalised care and many approaches to training and education. The idea of the curriculum is that it describes the learning outcomes and educational aims for individuals from a multi-professional background, including medical and non-medical professionals, care workers, social prescribing, link workers, clinical pharmacists, and the whole range of professionals who work in primary and secondary care. It also provides a framework for training organisations so that they're able to accredit their courses, and we can ensure that the learning outcomes and the training they provide is integrated and cohesive in a personalised care curriculum. It also helps with commissioners and organisations who want to commission training for their workforce to make sure they have the correct skill sets to deliver personalised care to their patients and recipients of care. A little bit of history on how we developed the curriculum. The core group was a multi-professional group, and we wanted this to reflect the holistic skills of the team in primary and secondary care. It included educators, academics, but also hands-on GPs, non-medical professionals, physios, OTs, and also experts in shared decision-making, communication skills, and curriculum development. One of the things that we were keen to do is to make sure that we shared the understanding of what we really wanted to achieve by the curriculum and made sure that we built on existing work and used those works such as person-centred care framework to make sure that there was a continuation and consistency in the curriculum. The blueprint or framework of the curriculum also allows individual organisations to develop their profession-specific syllabus. We felt it would be very presumptuous of us to write detailed syllabus for lots of professional groups, and the intention of the curriculum is to provide that framework to align all that work that's done out in the community. We also wanted to include stories from patients and carers and stories from practice to make sure that we anchor our work in the real world of primary and secondary care. So what was our philosophy in developing the curriculum? Although the curriculum is primarily targeted at delivering the workforce and delivering training, we wanted to make sure that care was still at the heart of everything that we do. And as part of this, we wanted to enable people to think differently, particularly looking at their mindset in their professional work, moving from the problem-solving model of what's the matter to the enabling model of what matters to you. And this was a prerequisite to changes in professional behaviour. Attention to the use of language to promote the ethos of collaboration and enablement was central to writing the curriculum. So if we look at the curriculum structure in a little bit more detail. The curriculum structure, as I say, is based on personalised care. We wanted to focus on the learning outcomes that deliver personalised care to patients rather than concentrate on a checklist of professional behaviours for people to achieve in a rigid format. At its heart are the core capabilities. These are common to many professional groups, and the generic professional capabilities are central, but also we like to describe the values and behaviours of professionals in delivering personalised care. More specifically, were the capabilities in personalised care such as core communication skills, capabilities to engage people, and capabilities to enable and support people in their care. And this leads on to the 6 components of personalised care which Alf has described: shared decision making, personalised care and support planning, social prescribing and community-based support, support to self-management, enabling choice, and also personal health budgets and integrated personal budgets. We wanted to make sure that learning outcomes were relevant to the individual who are using the curriculum, and so we stratified the learning outcomes at different levels. At level 1 are the core capabilities of engaging with people and developing relationships. Level 2 is actually developing capabilities that enable and support people to take charge of their own care. and level 3 are the 6 components that I've previously described. However, we are aware that getting from the core capabilities to the 6 components is not a linear process, and there's many different pathways and skills and capabilities required. The curriculum therefore also includes all the models and approaches that are commonly used in practice, and these range from using a range of consultation models, health literacy skills, motivational interviewing, making every contact count, and knowledge, skills and confidence, health coaching and supporting behaviour change. And we've also included considerations of the remote and virtual environments. Looking at the core capabilities in a little bit more detail, we wanted to use a consistent template based on educational theory, and level 1 and 2 is very much concentrated on awareness, knowledge, understanding, and being able to provide those central core capabilities that are required for personalised care. The models and approaches had a format where we defined and introduced the concepts within these models and the interrelationships between the models. What were the key elements that are required for learning, and what were the learning outcomes specific to utilising these models and approaches. We've tried to incorporate stories from practice so that they present real life situations that we're faced with. And we've also provided background information on how to learn these components, what the educational methods can be used, and what will be the standards for training in curriculum delivery and sustainability. The 6 components of personalised care are also broken down with introductions, the descriptions of professional behaviours that you'll be expected to see in using these 6 components, and these are considered the higher level of learning outcomes, but also the learning outcomes are relevant to the individuals. They're not necessarily a process throughout the curriculum. They can be used in a versatile and flexible way depending on the previous experience and the previous expertise of those who are looking at the curriculum. It also helps plan the skill sets for the workforce in organisations and enables versatility in provision of training courses. Again, we've tried to include stories and examples and educational examples of how these can be applied in practice. We'd now like to show you a video that demonstrates what an inclusive organisation the Personalised Care Institute has been, and we're going to show examples of collaboration and partnership working from the many people who've contributed to the work. So thank you very much.
Hello, I'm James Sanderson, Director of Personalised Care for the NHS in England. I'm delighted to be speaking at the launch of the Personalised Care Institute. Personalised care for me means giving people choice and control over the way their care is planned and delivered, based on what matters to them and, importantly, building on the assets that they bring to their own care.
Continuity of care and personalised care are core to UK general practice, valued by patients and vital to a thriving NHS. This is why we support the Personalised Care Institute and the Personalised Care curriculum, and why I look forward to a long and fruitful collaboration.
At its heart, personalisation means professionals working with people as whole human beings, in context and as partners in support, care and treatment in the pursuit of their well-being and self-determination. It means respecting choices and bringing together professional knowledge and skills with the wishes, wisdom and self-knowledge that we all bring to health or care conversations.
Choice and control is at the centre of everything we need to do, and if we can have a shared understanding between health and social care about that, with commissioners of social care, employers in social care, people with lived experience, all being able to contribute to that vision, we can only improve the quality of lives for everyone.
The benefits of personalised care, especially in the mental health field, are far-reaching and really wide. I think it's really important that people who have got mental health issues or who aren't feeling so good at any particular time know that with personalised care it's going to be tailored to meet all their needs.
At Macmillan Cancer Support, we want to ensure that everyone receives this truly personalised care. And so we are really looking forward to working closely with the Personalised Care Institute to help shift the approach to care from asking, what is the matter with you, to what matters to you.
I think that personalised care helps health and well-being for all of us involved. As a pharmacist having conversations about medicines, I think it's really important to understand what really matters to somebody about their medicines and their health, and it quite often isn't the same as what we think.
I think personalised care is about giving people choice and control over their health and well-being, and therefore we need to empower general practice in order to empower the general population to take control of their health and well-being.
Where personalised care is implemented, there is a huge benefit to both staff working in that model and the families receiving that care.
It's fantastic to be part of the launch of the Personalised Care Institute. What does personalised care mean to me? Well, it's unashamedly about performance. From a patient perspective, we know patients do so much better if they're in control and feel ownership of their situation. And from a staff perspective, when they're enjoying their work and they're inspired by it, they do so much better as well.
I've been interested in personalised care for the last few years. In fact, it started during my training, where as a professional, I felt this responsibility to make decisions that are centred on patients' values and preferences. I think each of us are different in what we value, and it's really important to elicit that through our consultations and through our interactions with patients.
I'm really confident that the skills and development that come through the Personalised Care Institute will help us to build some new relationships and think about that balance of power. I think it's also about building new solutions, so actually thinking about what outcomes really matter for patients and users of services. Is it all about that number that measures your blood sugar, or is it actually your ability to do something like make a cake with your granddaughter?
Our personal hope is that the Personalised Care Institute can support understanding between social workers and health colleagues, add to interdisciplinary learning and mutual respect and appreciation, and ultimately to ensure services and people's experiences of social work and healthcare are much better integrated around their needs, their wishes and their rights.
So the Personalised Care Institute, it's going to baseline the training and the knowledge and capabilities that people need in order to have those conversations. And we need to make sure that it's actually evidence-based to be able to actually have the conversation with the person, making sure that we're actually empowering them, increasing their knowledge, skills and confidence to be able to carry out their roles.
So it's really liberating. I no longer feel the responsibility of needing to make sure people adhere to their medicines. It's a different kind of conversation where you can support them with their choices and be alongside them in that. I've kind of realised that people make choices about whether they take medicines every day, sometimes several times a day. And so actually the choice is already with them. It's just that a personalised care approach helps them to have a different kind of conversation and perhaps to meet their needs more.
The barriers are not as great as we thought, and staff are very able to work in that personalised way, delivering care across specialties and for the benefit of those families and their newborn baby.
I think that by delivering training to a large number of staff at a very high level of quality, we'll be able to move forward on this agenda and start delivering the care that patients and users of services have been asking for some time.
Personalised care provides a real opportunity for the country to develop health and care systems. And that's why it's great that we've joined together today with a number of partners to bring the Personalised Care Institute to life.
I would suggest that having a personalised style conversation will improve our own health and well-being. So everybody wins. So it's great that the Personalised Care Institute has been established to support us to develop the skills through training about how to have these different style of conversations with people. So thank you.
This new institute will bring together the evidence, it will set standards and help training by setting a curriculum for the future of personalised care. It's been a lot of hard work for a lot of people, and I want to thank you all for what you have done to get us to this point. And I really look forward to working with all of you in the coming months and years to make the personalisation of care the heart and soul of the way we practice medicine.
Good morning, everyone. My name is Pauline Foreman and I'm the Clinical Director for the Personalised Care Institute and a GP in West Hertfordshire. I'd just like to start by adding my welcome and thanks to you all. I can tell you that from where I'm standing, the guest list for today and the testimonials that we've just received look pretty awe-inspiring. Many of the individuals and organisations represented have been working tirelessly for many years to develop the personalised care model and transform the delivery of care for patients. The Personalised Care Institute exists because of your work, and it's really great to be able to celebrate that with you today. My brief for this morning really is to talk about the Personalised Care Institute accreditation process and our new e-learning platform. So accreditation is really an independent validation of the quality of a programme of learning, and it ensures that individual healthcare practitioners and commissioners can easily access high quality training in personalised care. So accreditation is really what the PCI is all about. You've already heard from Alf that we've got a target of training a minimum of 75,000 healthcare practitioners by 2024, and we hope to exceed that. Well, I'm absolutely delighted to tell you that PCI accreditation is now open for business, and we welcome applications from training providers from today onwards. So this slide just gives you a little bit more information about where accreditation sits in terms of our governance processes. You've already heard from Steve about the way in which the curriculum has been designed and developed, and out of this has come the training standards for personalised care. And the accreditation process is really about ensuring that they're delivered in practice. So how does it work? Well, providers need to supply us with a range of evidence that relates to aspects of their organisational and educational governance and their quality assurance processes, both internal and external. They need to map their programme to the curriculum outcomes they seek to deliver, and they need to meet the training standards as set out in the curriculum. The training standards really relate to four aspects of the programme, and these are design, delivery, monitoring and evaluation, and sustainability. Providers also need to demonstrate an understanding of the learning needs and context of the professional groups and the NHS systems they seek to deliver to. And this really reflects the fact that training up individual healthcare practitioners to deliver aspects of personalised care is not really enough to enable whole system change. And that's what we're really looking for here. It's absolutely essential that the management team, and in fact the whole organisation, is prepared to deliver personalised care if we want this to have impact. So a little bit more detail about our accreditation process, and we're very grateful to the group of providers who helped us with this, piloting the process and giving us some very useful feedback. So in practice, the provider will submit an application form with the evidence that we've requested. This will then be assessed by two independent assessors, and they will make a decision, and hopefully in the vast majority of cases that will be a positive decision to accredit the programme. And in some cases we might need to ask for a little bit more evidence. Our plan really is to provide an outcome within 4 weeks of complete submission of an application. So this is a screenshot of the portal on our website for learners, trainers and commissioners. And learners and commissioners will be able to have access to a list of accredited training providers by entering through the portal. Training providers will also have a separate entry point, and they will be able to obtain information about the actual accreditation process and how it works, and some resources through this. And basically we want to support providers as much as possible with the process. It's a new process, and we do very much welcome feedback. We are planning to have a webinar to support providers, and the details of that will be available on the website very shortly. So I'm going to move on now to talk a little bit about our wonderful new e-learning platform. So this is the landing page for learners when they click through the Access site for e-learning. So as I've already mentioned, the PCI is primarily an accreditation organisation, but we have commissioned some e-learning. There is quite a bit of e-learning out there, and one of the first things that we did was do a scoping exercise so that we could find relevant high quality resources that were already there and identify some gaps. So these resources have been curated and a selection of them are now available on the learning platform. Our philosophy is very much to work with good resources that are already out there and to build on them. We've also agreed some priorities for new e-learning development, and these are the first 4 modules that we've commissioned. So core skills, I'm going to tell you a little bit more about in a minute. That goes live today. That's our first module. Then we've got personalised care and support planning, shared decision making, understanding behaviour change, and core skills. And these have all been co-produced with people with lived experience. So I'm going to show you a little clip now, which showcases our first e-learning module, the core skills. Okay, so this is really a whistle-tops tour. It's going to move through fairly quickly, so you won't be able to read all of the text, I'm afraid, without getting dizzy. But it's really just to give you a flavour of the ground that we're trying to cover here, the quality of the graphics, the level of interaction, and the focus on skills development. So thank you for listening. Please do have a look at our website and do register and signpost others to it whenever you can. We really do want to encourage people to register for the website because we want to develop a very active community of practice via the website. Please do continue to work with us to promote personalised care and the Personalised Care Institute. At this point, I want to bring you back really to the reason that we're all here and introduce you to 2 women with lived experience, Zainab and Debs, whose testimony about the impact of personal care on their lives is incredibly compelling and also very moving.
Personalised care has made a huge difference in my life. Being able to have shared decision making and have support and care plans means that I can now live my best life.
Hi, my name is Zainab Garbasani and I have sickle cell anemia.
So sickle cell anemia is a genetic disorder that affects your red blood cells. So rather than being circle shape, my red blood cells become sickled, which is basically the shape of a banana, in certain situations such as when I am exposed to extreme weathers and temperatures, such as very cold or very hot temperatures, or physical stress. So the main symptom of sickle cell is severe pain. So this is called sickle cell crisis and happens when you have sickle cells blocking your blood vessels, and this can happen in your legs, arms, anywhere in your body. So basically sickle cell is a systemic disorder that affects all of your body. So I didn't really know about personalised care until I joined the Personalised Care group at NHS England, NHS Improvement. However, learning more about the work that they do, I realised I had had experiences of personalised care, and good personalised care and also bad personalised care. The first day that I had a sickle cell crisis in Bradford, I was at university, I was on my own and I went to A&E because I was in severe pain. Unfortunately, because the consultants and the nurses at A&E did not know much about my condition, when I told them that I was in crisis and these were the things that I needed to do, because obviously I had lived my entire life with sickle cell and I became very good at knowing what works and what doesn't work for me. I wasn't listened to, and unfortunately that meant that in the end I spent 8 hours in severe pain in A&E without any painkillers or intervention. In the end I decided just to go home because actually I was probably better off managing my pain and what I was going through alone at home. The next day I called the haematology department and an amazing specialist nurse came to me, we sat down and we wrote a care plan. She listened to me about what works for me and what doesn't work for me. She listened what my needs were, what I wanted basically. And what it meant was that the next time that I had to go to A&E, I had a support plan already in place. So then I could tell the nurses and the doctors, this is my plan, this is what needs to happen. And that time, within 20 minutes, I was already seen. I had been given my painkillers, I had been given fluids, and I was already admitted basically. So having now experienced good and bad personalised care, I know what difference it can make. So I am very excited to be involved in the launch of the Personalised Care Institute, and I can't wait to see the impact it's going to make on many other people's lives. So having good personalised care means that your illness no longer has to be a barrier to your life.
Hiya, my name's Deb, I'm 34 years old and I've got a condition called ankylosing spondylitis. I was diagnosed about just coming up to 5 years or so ago now. It's quite a complicated condition, and I always try and say to people, if you just look at it as a form of arthritis, that will help you make sense in terms of understanding what it is that it's all about. One of the primary things is pain in your spine, so you can get fusion between your vertebrae, which makes it really difficult to move around. But for me personally, I get issues in all of my joints, so that's my ankles, my knees, my shoulders, and that's been one of the many problems in terms of one, getting a diagnosis, but two, getting kind of treatment and support. I started getting symptoms when I was about 11, so just coming up to my teenage years, which I already think are really difficult times for young people as it is. So imagine kind of trying to go through that and then having all this extra stuff on top with not really knowing what it was. I was really struggling. I'd started to get quite low and depressed. I'd started isolating myself. I was so tired. Chronic fatigue is a massive part of this condition. My friends were all going out and I wasn't able to do that. My journey to diagnosis has been an extremely long one. Like I said, I started symptoms at the age of 11, but only got diagnosed just before I turned 30. Those appointments prior to getting that diagnosis have been really, really challenging. I used to come home crying all the time, feeling like I'd just not been listened to. I was going in with so many different problems, and they were never looking at me as a whole person. It was always just on that day with that particular symptom. When I got my diagnosis eventually and saw my consultant that I'm with now, everything changed dramatically for me. It wasn't just a simple thing that he did. Well, in fact, it was a really simple thing that he did. We sat down and we had a conversation, and the thing he asked me was, what is it that you want to achieve from today? And that was it. We sat and we spent an hour talking about what things were important to me. He wanted to know all about my hobbies, my interests, the different treatment that I'd already tried and how that had impacted upon me. He was interested to know if I'd heard of any other treatment from anybody else that I wanted to either ask more questions about or try myself. And just generally where I wanted to go in life and how he thought he could try and help. And I'd kind of never really had that before, and when he first had that conversation, it took me aback a little bit. In fact, I just cried. I'm quite an emotional person anyway, and throughout that hour-long appointment, I think I cried for probably about 4 to 5 minutes of it. And I was just like, I'm just so happy someone's finally listened to me and what I want. Having different conversations has really made the huge difference to me. Like I said, it wasn't anything massive that anybody did. It didn't cost anybody any more time or any more money. What it was just an entire shift in relationships. He respected my knowledge and my expertise. After all, I'm the one with with the condition, and I appreciate that he's got a medical profession and he's got lots of knowledge to bring to the table, but equally so have I. Look how beautiful this is, how can you not want to be here? So as well as this being part of the way I manage my condition, it's also a massive passion of mine. Can't beat a bit of fell running.
What wonderful illustrations of why the Personalised Care Institute is so important. I'd like to thank Steve and Pauline for their super overviews of the curriculum, of the accreditation process and of the learning resources. They've done an amazing job with the rest of the team, delivering work at breakneck speed in an environment which I must say has been distracted by other things. So thank you so much to both of them. We've got good time for questions now, and I know questions have been collated from a range of different sources. So Becky, I think that you have got some questions ready for us. Please fire away.
Absolutely. Thank you, Martin. First one probably for Pauline and Steve. We've had a lot of interest about patient involvement so far in the Institute. Has there been patient involvement in the co-production of the curriculum, and how will that work going forward with the e-learning development?
Obviously the curriculum was built on previous work that included extensive patient feedback both through the literature and by lived experience. And also in developing the curriculum we had a very wide stakeholder group that included many patient organisations, and indeed the core curriculum group itself included members who had their own lived experience of long-term healthcare needs. And of course we don't view the curriculum as a static document. It's a live document. It'll be developing over time, and we're hoping to assimilate much more in the way of patient feedback and experiences. It'll help us develop the training and learning for people using it to make it relevant and effective for delivering personalised care.
And likewise really, Becky, for the e-modules really, they have all been co-produced or are being co-produced, the ones that are still in production, with people with lived experience, very much so.
That's great, thank you. One perhaps for Martin to start. There's some concern about the effect of extended use of telephone consultations. They're often less than 10 minutes long. It could significantly reduce the identification of social issues, for example, which would normally lead to the referral to social prescribing link workers especially. How could that be tackled?
Yeah, this is such an important question, isn't it? Because we know that the environment within which we're working in both the health and care sectors isn't always a conducive one to deliver the kind of stuff we're talking about with personalised care. It's really important that we train people to deliver personalised care in the real environment that we're working in, and part of that is about remote consultations, telephone and video consultations, and part of that is about delivering it in a time-pressured environment. And that, I think, has been adequately reflected both in the curriculum, in the accreditation process and in the design of the learning modules. Of course it would be easier to deliver high quality personalised care always face-to-face and always in long consultations, but that's not the reality of the environment that we're working in, and I think people will be adequately prepared for the environment that they are working in.
Thank you, Martin. One for Pauline on accreditation. Will you be fast-tracking established providers, such as universities, for example, through the accreditation process?
And the short answer to that is no. We'll be treating everybody equally, actually, in terms of our accreditation.
Thank you. Again, one possibly for Alf and Martin. A big thank you for setting the vision about what we need to be working towards. Do you think it would be helpful to also talk about what we should move away from? So things such as rigid adherence to protocols and guidelines. Do we even look at shifting incentive payments, such as QOF, for example, to incentives and targets which are defined by the patients themselves?
So let me respond very quickly and then I'll pass over to Alf. That is a key question, isn't it? Because I think that the practice of healthcare, in my case in medicine, in general practice, has become very guideline, very protocol orientated, very driven by biomedical evidence, and of course that's really important in terms of delivering good health outcomes. But the risk is that it's become less personalised, and I think we will be making compromises on the kind of outcomes that people want to see if we deliver truly personalised care. And that might have consequences for morbidity and mortality statistics. And I think we just need to be honest and open about that and having those discussions about the consequences.
Could I just add that Sir David Haslam, who was the chair of NICE for many years, one of his great quotes was that guidelines are not tramlines. And actually every NICE guideline now, at the very front of it, says that they are there to inform practice and not to constrain practice. And the idea is that shared decision making should be implicit in everything that we do within a guideline. What I would add as well is that when evidence-based medicine, evidence-based clinical practice started in the 80s, and I was in Oxford in the 80s where it started, shared decision making was a core component and remains a core component of evidence-based clinical practice. Important.
Thank you. And moving back to patient stories, what kind of mechanisms, Steve and Pauline, have we got in place within the Institute to make sure we gather those stories as we continue the work?
I think we are still actively looking for stories because, as Steve has already mentioned, the curriculum is a living document. We are going to keep it under regular review. In fact, we're going to review it again in December. And we will be actively looking for stories from our stakeholders, for example. And we would welcome any offers of help, really, in that department.
Can I just add as well, very much has been by word of mouth and by people's contacts and their own experience. And people that are coming into contact with professionally and personally all have stories to tell, and it's a very rich source of information. So we're very keen to hear from anybody who has a story to tell, and we will include them, and we can help write them and include them in the curriculum.
Thank you. We've got a really good question now. Of course, it's the RCGP that is convening the Institute, but it is a partnership of over 40 other partners and growing all the time. So there's a question about, can anyone access the training? If I'm not a healthcare worker or I'm not somebody that works in primary care, can I access?
Shall I answer that from a curriculum point of view? The answer is yes. It is designed to be flexible and versatile across a multi-professional workforce, and it is designed for anybody involved in health and social care to participate. The idea of the learning outcomes is that people can select and use parts of the curriculum that apply to the skill sets that they need. It's not determined by professional status or seniority and should relate to the personal experience of those undertaking the curriculum.
I would just add to that, Becky, that obviously anybody can access the accredited list of training providers and access the training with the same assurance as anybody else, really.
And another piece from me, the core skills piece has actually been designed for all staff in health and social care, not just health and care professionals who have direct patient contact, so people like receptionists, cleaners, etc. I think it's really important that we throw our arms wide and say this is for everyone.
Thank you. And a similar related question, will there be other types of personalised care training available via the website and other resources?
Absolutely, yes. E-learning is only the beginning. We expect to be accrediting lots of facilitated training. Initially when we started we thought a lot of that would be face-to-face training, but obviously things have changed and a lot of that training has now moved online while COVID is around. So yes, there will be facilitated training. We also very much hope that there will be additional learning events that we'll be holding as well, and very much developing, as I said, a community of practice via our website.
That's lovely. I think this is possibly one for Alf, but please everybody do feel free to chip in. How will you measure the success of the PCI? Will it be people trained or actually the quality of the training? So perhaps a Pauline Alf question.
It's both. We want to reach as many people as we possibly can. We've set ourselves the ambitious target of 75,000 people. I'd like to think we'll reach an awful lot more than that, because I believe that the training is going to be so engaging, so exciting, the word's going to get around and people are going to say, actually, why don't you take part in this? What it's really about as well is quality. This is very, very, very high standard stuff, and so it's numbers and quality together.
Yes, so from our perspective, we will obviously be collecting data via the website again, primarily on completion of training, but we will also be capturing data on the impact of training as well, and we will be organising an evaluation of the programme, and that sort of, we're looking at our specification for that at the moment.
Thank you.
And that impact, if I can just come in, is going to be realised over time. It's not as if you finish a training course and everything is okay. The opportunity for lifelong learning, for sharing your learning with colleagues, for supporting at a local level peer learning courses is all there and is all really important. So I'd expect people to feel confident to deliver a certain level of personalised care, having completed the training, but to be continuously improving what they're doing over time.
Thank you. And the last question, how will you ensure that training stays relevant?
If I can answer that, I think the vital thing is feedback, that we've written a curriculum that will actually provide the basis of the standards, but obviously, as I said, it's going to be developing over time, and every bit of feedback we get will help us learn and help us develop the programme. So I think it's vital that people feel able and willing to give us any feedback at any time, and we will be accessible electronically, email, however, through the website. So I'd encourage as much input as possible, really.
It's also a key part of the accreditation process. Providers who are accredited will need to provide an annual report that gives us some evidence, exactly as Steve was saying, about the feedback, but not just the feedback, but how they've actually used that feedback to improve their course, to bring it up to date. So that's absolutely key.
A question we've been asked a lot is, will all of this information be available after the launch? And yes, it will. We will be making the slides and a recording of the presentation available via the website.
So it just remains for me to thank you all for joining what is an incredibly exciting first day. It's a first day. For me, it's the first day I've put a jacket on for 6 months. It's the first time I've been in the Royal College of General Practitioners for 6 months. It's the most beautiful autumn day here in London. But please, please, please see this as the beginning. Please, please tell your friends, your colleagues about the Personalised Care Institute. And I've got a little cheat sheet here telling me where to go. It's www.personalisedcareinstitute, all one word, .org.uk. If you're not doing anything in the next half an hour, have a look. Start doing some of the work yourself online. It is absolutely fantastic. It's really, really engaging. And for those of you on Twitter, follow us on @pers_care_inst. Thank you so much. Do enjoy the rest of your day, and please enjoy the rest of the journey with us. Thank you.